good morning. I'm Maria Paz Grisales, a PMR specialist from Colombia and vice chair of the ISPRM Youth Forum. Today I have the pleasure to interview Dr. Walter Frontera. He is professor in the Department of Physical Medicine, Rehabilitation, and Sports Medicine at the University of Puerto Rico. He is an internationally recognized expert on aging, exercise, and rehabilitation. Dr. Frontera has been invited to be a keynote speaker at the next ISPRM Congress in Marrakesh. Good morning, Doctor. How are you today?
Good morning. I am very well, and thank you very much for this opportunity.
Without giving too much away, can you give us a preview of the main insights you plan to address in your keynote during the Congress?
Yes, of course. I think the lecture will address 2 or 3 different issues that I think are relevant to what is happening in our field and in healthcare in general. The first has to do with the demographic changes that are happening globally. That is the increase in the number and percentage of people in older age groups. This is a phenomenon that has been reported all over the world, different rates, of course, but all over the world. And I think it is an issue that we should be paying attention to. Of course, part of that really has to do with increased scientific interest in understanding the aging process itself, but also the consequences of that process. That will take us to the second agenda item, I would say, and that is older people have a higher prevalence of chronic health conditions. And in addition to that, they lose functional capacity as with the passage of time. So it is relevant for people in rehabilitation to understand exactly why and how does that happen. And the consequences of functional losses, I think, are well known to the people in the rehabilitation world. And of course, then the third issue has to do with the basic questions. So if we understand what is happening and we can measure it, which is an important issue here, what can we do about it? And I think our suggestion has always been to use rehabilitation interventions to address some of these issues that older people have to deal with. And so we will discuss the rehabilitation interventions that have been shown to be effective and that can be implemented essentially anywhere in the world. This will give us the opportunity to emphasize the relevance of strengthening rehabilitation in health systems, but also at the level of the community. So my intention for this keynote lecture is to address all of those issues and present it to the audience for discussion.
What specific types of rehabilitation do you think are the most beneficial for older adults?
There's a number of things that we could do, of course. The most important one, or the one that has been shown to be safe and effective, is the use of exercise-based interventions. And there are different ways of implementing exercise programs that will address, for example, muscle weakness, loss of flexibility, balance problems that are all very prevalent in older adults. Now, we should not only focus on exercise, but also include nutritional interventions that have been shown to be synergistic with the exercise. And of course, we have to remember that older adults may have health conditions that may require more specific rehab interventions that we use in the clinic all the time. An example of that would be interventions that may prevent or reduce the number of falls. So I think we can have a very healthy discussion about how rehabilitation can be implemented, offered to older adults to minimize the risk of injury enhance their functional capacity and, of course, quality of life.
Thank you. What are the most common misconceptions about aging and exercise and rehabilitation that you encounter in your practice and research?
There's two that come to mind immediately. One is that older people cannot exercise because it may be dangerous for them. I think this is a misconception that has been shown to lead to more problems and not to solutions. I think it is very clear that older adults, even in their 80s or 90s, can safely exercise. Of course, we have to make sure that the exercise prescription is correct and it takes into account health conditions that may be affecting older adults. So I would say that's really the most difficult myth or misunderstanding when you're working with older adults. The idea that older adults have to be passive, inactive, and careful with whatever they do in terms of physical activity is not acceptable any longer.
Thank you, Doctor. Since we are going to an international congress, do you see any significant differences in how aging and rehabilitation are approached in different parts of the world?
Yes. Aging is a global phenomenon, that we all know that, but the reality is that there's a lot of things that relate to age and aging that are different depending on the culture, health systems in different countries, and so on. So there's a lot of factors that are more local than international. And I think we need to take that into account. When we have discussions like this, we tend to generalize. And I think it's important for the people in the audience to then, think about what we're discussing and adapt it to their local, regional, national level, depending on the realities in their countries. So I think that's one of the most important issues here. If we're going to strengthen rehab in health systems so that older adults can take advantage of rehab services, we need to understand what is happening locally and avoid the one-size-fits-all approach to this.
Thank you, Doctor. How do you think lower middle-income countries are available to strengthen these rehabilitation systems to have a better approach to this aging population?
Yep. Well, I think we need to remember that in the future, close to 70 to 80% of people in this age group will be living in low and middle income countries. And so this is something that the aging of the population is something that all countries have to pay attention to. Now, it will be important for these countries to, again, adapt the recommendations that we're making to their national health system. And of course, when we make recommendations about how to intervene or work with older adults, I think we need to take that into account. Now, I have to say, I mentioned exercise before as an important intervention. I think it should be obvious to the audience that exercise is one of those things that can be implemented effectively almost everywhere in the world. You may want to change the prescription itself, but the intervention, exercise-based interventions, can be applicable almost universally. So, to some degree, the way we address the aging of the population may relate to the resources that countries have, but to some degree, it's not about resources, it is about policy at the national level that will pay attention to the needs of older adults.
Thank you, Doctor. Finally, could you invite us to join you in the next Congress in Marrakesh?
Of course, I would like to see all of you present in Marrakesh. I think we're going to have a fantastic Congress. I would like to congratulate ISPRM for this initiative and our colleagues in Morocco for their interest in organizing the Congress. I think this is a fantastic opportunity for people from different parts of the world, different countries, to come together and have a conversation about the future of physical and rehabilitation medicine. So I hope to see all of you in Marrakesh. Thank you very much for the opportunity.
Thank you, Dr. Frontera. See you in Marrakesh.
See you there.